Good day and thank you for listening to me. I am Muhammad Tayyib. I am PhD student and head nurse in Bern Unit. We chose the topic why patients use traditional medicine in Bern. Through working in Bern Unit, many cases admitted to Bern Unit as a wound infection and other case coming after complication as scar or contraction. For that, chose this topic. We will speak about introduction, research question, methodology, finding and conclusion, recommendation, and limitation. Traditional medicine is a treatment, not in the standard medicine sector. Different mixture use. A significant number of people in Palestine utilize traditional medicine. Among Palestinians, 20% from admission to Bern Unit after use the traditional medicine in 2020. In Palestine, no literature about the traditional medicine and why use. Burn patients require multidisciplinary approach as a nurse, physiotherapy, physician, nutrition, and other to give good outcome and to prevent complication for the patient. Research question, why patients use traditional therapy in Palestine? What are the characteristics of traditional therapy for patients used in this population? What are the sources of information for the traditional therapy for Bern use? The main objective to know the patient why use possibly traditional therapy in Bern. The methodology, study design, quantitative approach, cross-sectional study was conducted in the main governmental hospital contained Bern Unit, south of Palestine, during 1 year in January 2020 to 31 December 2020. Study area, the study was conducted in south of West Bank. The population, all the patients coming after using traditional medicine and admission to Bern Unit in Hebron Governmental Hospital. Tools, the questionnaires was developed into the main section, covering demographic information as gender, age, place of life, Bern before who decided to go to traditional medicine. Second section contained 13 items divided in 3 subsections. The first subsection, 6 items related to dissatisfaction with conventional medicine. The second subsection related 4 items, the value, customs, and beliefs. Third subsection, 3 items related beliefs and things. The questionnaires items were arranged into yes and no. Validity, the instrument used in this study was constructed by the investigator and supported by previous study as RAE. Reliability, the Cronbach alpha is high, obtained over the scale was 0.829 to indicate high consistency among the study items. Ethical, we start ethical from university to the patient. The participants were informed through consent form attached with the questionnaire, informed about his right to refuse or to withdraw at any times during the study. Result, demographic variables we study with gender, 53% are male, and most of the burn, nearly 62% are children. Living distributed from cities 36%, village 46%, and camps and Bedouins 12%. Source of information, Most of the information about traditional therapy coming from internet, then from friends, media, family, health workers, and others. Who decided to go to the traditional therapy? Most decided by father, then by mother, then by grandmother and neighbor. 55% of patients used traditional therapy before. Most of their patients are under 14 years, and 61% are children. Why use traditional therapy? Dissatisfaction with conventional medicine, 54% dissatisfaction. And the patient values custom, 46 patients. Believe and thinks, 45 patients. About the correlation between the use of traditional therapy and demographic variables as social status, living, job, use before, who decided we use one way ANOVA test to measure the correlation. A significant, it's more than 0.05%. It's more than no relationship between social status, living, job, used before, and who decided and used traditional therapy. For the conclusion, the percent study was designed to provide comprehensive analysis why patients use traditional therapy in the Bern in south of West Bank, from static admitted to Bern unit in Hebron Governmental Hospital to 90 patients in 2020, with 29% of admission use traditional therapy. According to the questionnaire used that divided in 3 sections to know why use traditional therapy. First, dissatisfaction with conventional medicine with high percent, 45%. The second section, the patient value customs with percent, 46%, and the third section, believes and thinks, 45%. For use can summarize. First, for Bern is convinced that traditional therapy is best than conventional medicine. Do not leave a scar, and rapid healing based on expert society and elderly. Another explanation for use traditional therapy or medicine in Bern think as philosophy. No side effect for medication. It's natural mixture that use from nature, not contain chemical materials, and thought the body, it's myself, can use anything to the treatment the body. Recommendation of the study, the information derived from this and similar study can serve as a useful data derived from controlled study of the clinical efficiency of traditional therapy in Bern. The study result to stimulate further dialogue among the biomedical community and drug companies regarding the potential values of alternative treatment. Policymakers and healthcare professionals continue to debate reform of the present healthcare system and to understand why significant portions of the population is going to outside healthcare system to treat Bern and other illness and wellness. Political leader and healthcare experts still discuss improvements in the current health system. Limitation of the study. This study is its cross-sectional nature, which preclude drawing any definite conclusion regarding causes and effect relationship. Limitation for patient Bern, only another patient use a traditional therapy. Thank you for listening to me